your host, Amberlyn Carroll. Thank you for joining us on this episode of Medwatch today. A carcinoid tumor is a rare type of cancer that can slowly grow throughout the body, and less than 10% of people with carcinoid tumors have or develop symptoms. For one local Valley woman, her rare cancer diagnosis meant finding a physician that understood a distinct, multidisciplinary approach to her care and had access to state-of-the-art technology to save her life. Rosalind Logan was living a normal life, working at JCPenney's when she noticed something wasn't quite right.
At first I started noticing that the more I moved around, the more I walked, the more breathless I was. I could walk just a very short distance and I had to stop and get my breath because I couldn't talk to my customers. I started forgetting things that I knew.
She had some episodes at work where she got so weak and just so overwhelmed. She was getting dizzy. She would almost fall down. Her coworkers would have to catch her.
Rosalind's daughter Elena took her mother to the doctor, where they discovered she in fact had a carcinoid tumor in the bottom of her right lung, blocking her airway.
She in particular had a right lower lobe, initially diagnosed with a neuroendocrine tumor, which by itself is a big category of different kind of cancers. She had various symptoms that are vasogenic. Typically, that points us to a particular kind of cancer called a carcinoid.
Rosalind was referred to Dr. John Lynn, a cardiothoracic surgeon with community medical centers, because of how complex her case was.
Her particular case was also complicated in that it was advanced in staging, in that it was very close to the heart.
Carcinoid tumors are not only rare, making up only 0.5% of all types of cancer, but they can spread to other places in the body.
There was cancer that has begun to spread into the lymph node, which we did not know before. The decision was to go ahead and do a right lower lobectomy for her. And we do this with our the most advanced thoracic surgery technique across the United States, which is the robotic platform.
Utilizing robotic technology, Dr. Lynn successfully removed Rosalind's tumor.
Thoracic surgery, the way our body is designed with the rib cage, again, it's meant to protect your heart and lungs. We have an extensive nervous system around the ribs. For us, however, to get into the lung and the tumor on the inside, we have to really go in between the ribs to achieve that. And that, in many ways, we have to cross the barrier and to kind of stir up the nervous system to get into there and accomplish our job. Using the combination of robotic assisted technology and under the control of the surgeon, that we're able to have more dexterity in how we manipulate the cancer within the tumor.
Because of the tumor, Rosalind developed carcinoid syndrome, which brought on various health issues like blood pressure fluctuation, diarrhea, forgetfulness, and more.
It has caused something very rare with me. It causes shaking. My head and my hands shake, they tremble. And there's emotions, a lot of emotions that come with it.
Rosalind continues to be monitored and take medication to control her symptoms, keeping in close contact with Dr. Lynn.
I couldn't have done this without him. I couldn't have done this without his support. It means a lot. And the fact that he's been there for my daughter, yeah, it means a lot.
Not only does Community Health System provide state-of-the-art life-saving technology in the Valley,
it means a lot to the patient when we bring these advanced technology, I would say the latest and greatest to people.
but the kind of comfort and care for families that extends a higher quality of life beyond its doors.
Delivering the results that get people back into their life and do well in their life is always my goal.
It lets me know that there is life after something so serious, and the fact that we have so many wonderful doctors that can help us through this in our area.